Monitoring, learning, and evaluation for targeted performance management of subnational tailoring in Nigeria malaria project in conjunction with Kano State Ministry of Health and also in conjunction with Solina Center for Integrated Development and Research and also with collaboration of African Institute for Health Policy and Health System of David Omahi Federal University of Health Sciences, Ebonyi, has presented an adoption of policy brief on subnational tailoring of Nigeria malaria strategic plan for Kano State 2026. When presenting the adoption to state government, the Vice Chancellor of David Omahi Federal University of Health Sciences, Ebonyi State, Professor J.C. Oneke, has commended the state government for its effort on health and also urged the state government to redouble its effort.
Policy reforms and policy strategies, we were so much encouraged by the kind of efforts that was made, even in the distribution of mosquito nets in Kano State. We were distributing it with camels, with donkeys, with trailers. It was going everywhere, and that was very, very commendable. And the partners saw it as a very, very pragmatic effort from the Kano State government, and of course, driven by the Ministry of Health here. And we felt that other states should learn from these very laudable efforts that Kano State government has put in. So I want to congratulate you, sir, on the effort, and we hope that these particular subnational tailoring efforts that we have done in this state will also become a leading example for other states in Nigeria to copy. And so we have gone through processes of engagement, what we call co-creation, with the experts from the academia and from the Ministry of Health, and then other ministries and agencies that are represented here. And together we went through the process of co-creation to identify what we call context-specific policy recommendations that are going to work in Kano State. And that is what we have put together in the policy brief that we have here.
When shedding more light to the journalists, the Vice Chancellor, David Omahi Federal University of Health Sciences, Ebonyi, Professor J.C. Oneke, said he was in Kano just to give his contribution to the health sector in Nigeria.
Yes, I'm here in Kano to support the National Malaria Elimination Program, subnational tailoring of malaria control in Kano State. And I'm here as one of the consultants to the project under the African Institute for Health Policy and Health Systems that is located in my university. And as part of the consortium that is having the Bill and Melinda Gates Foundation, the Clinton Health Initiative, and then, of course, the Malaria Consortium, and then also the Solina Center for International Development and Research. So what we are here to do is to engage the Kano State government officials, the policymakers, senior policymakers in the Ministry of Health, and then other critical stakeholders in a process we call co-creation for subnational tailoring of malaria policy. In the past, when policy reforms are to be made coming from the national, the state is not effectively engaged. So this is the first time that we are bringing in a policy reform for malaria control, and then we are now following the process of subnational tailoring, whereby the stakeholders and the policymakers at the state level will sit down together, look at their context, and come up with what we call context-specific policy recommendations that can work for them in their state, because they are here in the state, they have been working for years in the state, they understand the terrain, they understand the context. So you can't make any policy from outside and impose it on the state and expect it to work. So that's why, for over a year now, we have been in active engagement with stakeholders and policymakers from Kano State. And it's been quite an exciting experience because we have come up with a policy brief that has been adopted today by the State Ministry of Health. And this policy brief has recommendations that are specific for Kano State. So it's exciting because the stakeholders and the policymakers put it together. So it's not as if anybody imposed it on them. They put it together that this is what will work for Kano State. And we are very, very excited because we have learned a lot, even from working with the stakeholders here. And we have encouraged them that the capacity they have acquired in this program, let them be ready to guide other neighboring states like Katsina, Jigawa, and then some other states that are nearby.
The Commissioner Ministry for Health, who was ably represented by the Permanent Secretary of the Ministry, Pharmacist Amin Bashir, he spoke on the event in Hausa language.
An lura da cewa jihohi daban-daban suna mataki daban-daban na shawo wannan mataki. So ake yi a kashe malaria ɗungurungum a Najeriya gaba ɗaya. To amma idan muka duba kamar jihohi irin su Lagos, su sun kusa kaiwa gaci. To mu kuma sauran jihohi ya za mu yi mu tsatsefe abubuwa wato na matakan da za mu ɗauka wanda zai yi daidai da irin matakin da muke yadda za a shawo kan wannan malaria shine dalilin da yasa muka zo wannan ɗakin taro.
Representative of Solina, Dr. Nura Yahaya Karai, has this to say during the occasion.
Continue to support in terms of developing such kind of policies. Kano State had been a pace setter, not only in terms of this malaria policy for the subnational tailoring, in terms of a lot of other policies. Kano had always been a pace setter, and other states do learn from Kano State. So we'd like to thank everyone and wish each and every one of us safe travels back to our various destinations.
Participants at the occasion include the academia, expert in health from different sectors of health in Kano and Nigeria at large. It has been Abubakar Muhammad reporting for AL-SABABA TV from Kano.